Okay, so my name's Jeri O'Dowd. I'm a registered nurse, and I'm also a registered yoga teacher. I have my 200-hour yoga training. I am a gentle yoga teacher. I teach to cancer patients. So just to begin my journey with yoga and CAM, I started, and I won't say how many years ago, but it's been quite a few years ago in oncology nursing. After I lost my mother to breast cancer, I left clinical nursing and went into pharmaceutical research. So I currently work as a clinical manager in oncology. So I now am in a very stressful job and have been for quite some time. So through this stressful job and children and a divorce, this is where I ended up. And as so many, I ended up being diagnosed with an anxiety disorder. I ended up being diagnosed with IBS. Then I ended up being diagnosed with inappropriate sinus tachycardia, and I was suffering from chronic migraines. So I visited different physicians, and each physician only gave me a prescription to treat the symptoms. So it was about at age 45 I knew I needed to make some major changes. So this is what led me to a 200-hour yoga teacher training. And then from there, I enrolled into achs and then began teaching yoga. So this didn't happen overnight. Okay. So this is just a little shot of my gentle yoga for people living with cancer. I do this through a grant from our local hospital. This is now in its 4th year, and I conduct the class at the YMCA, and although it's not the ideal location, it's donated to us, and so this program is free for the attendees. So why I chose yoga? Yoga eases mental and physical tension, it supports overall health, and it's a mind-body practice. So I had practiced just enough yoga in my past to want to learn more. So I enrolled in the yoga teacher training to simply deepen my own practice and to reclaim my own health. And at the time, I had not really considered actually teaching yoga. So what I learned from yoga teacher training, I learned how to breathe. I learned how to be mindful. I learned how to connect with nature. And I learned how to eat. Okay. So in summary, through pranayama, through breath work and mindful meditation, I learned to relax and give my body's continuous response to stress a much needed break. My favorite quotes during yoga teacher training became, if you do not have time to meditate, meditate. And if you're depressed, you're living in the past. If you're anxious, you're living in the future. If you're at peace, you're living in the present. So through yoga teacher training, I also attended an Ayurvedic workshop, and this taught me a lot about yoga sister science. I learned to connect more with nature and to reset my circadian rhythm. So one of the most important things I started doing was going to bed earlier and waking up before the sun came up. And this has been a daily practice for me for years now and has made a huge impact on my health. So I learned to eat ethically, which led to a whole new way of approaching diet and nutrition. So what happened next for me? I gained support in health and wellness. I became inspired to share my experience. I desired to learn more, which led to enrollment at ACHS. So along this path, as my health problems began to disappear and I came off all my medications. So for someone who works in pharmaceutical research, a bit of an inner conflict developed over the years. But then I also began my interest in teaching therapeutic yoga and learning more about CAM. So I joined the International Association of Yoga Therapists and the American Holistic Nurses Association. I began attending related workshops and symposiums, and I began to research Master of Science degree programs that incorporated complementary and alternative medicine. So why I chose ACHS. ACHS Masters in CAM was one of the first programs of its kind to be accredited in the U.S. Distance learning and a flexible schedule were offered. So for me, this was really important. I had children. I worked a 40-plus hour work week. I traveled for my job. So I really needed to be able to have a flexible schedule. And I live in rural North Carolina, so distance learning was definitely a must. So the course content was what I was looking for, and the integration of CAM modalities with integrative healthcare. Being a registered nurse and being in the healthcare industry, it was very important to me that my studies were going to help me learn integrative healthcare versus an alternative method of healthcare. And the master's program is research-driven. Okay, this research-driven integrative approach is critical, in working in clinical research with oncology team members and with cancer patients. So hurdles and challenges. I've already mentioned my schedule. It does include long hours of work and travel. I do teach yoga. It's only once a week. Occasionally, I will teach. I'll substitute or teach on a specific topic if requested, like at our local yoga studio. But typically, I just teach one day a week. But it does take time out of my schedule. And I like my playtime. We do live on the coast, and we sail and we kayak, and we enjoy lots of water activities. So I do like to get in my playtime. Another big hurdle for me, which occurred during school, was Hurricane Irene. During Hurricane Irene, we were flooded out. We were without power. We eventually were without our home. So in the midst of a master's degree and working, we had to unexpectedly rebuild. And so I will have to say that ACHS and the staff at ACHS were just phenomenal in working with me and my schedule, and allowing me the time I needed to be able to complete my studies while dealing with a very intense personal issue. Okay. My other challenge was class selection, because there are so many great classes within the CAM program. So I'm in my final semester. I am in the midst of my capstone project right now. There are so many other classes that I have interest in, but it's time for me to wrap it up. So the areas of concentration in CAM that I chose were anatomy and physiology, pathophysiology along with CAM pathology and protocols, holistic nutrition, and aromatherapy. So as a yoga teacher, as a nurse, as a clinical trial manager, anatomy and physiology is very important for me. I took anatomy and physiology many, many moons ago in nursing school, but approached it from a completely Western viewpoint. So as I went through anatomy and physiology this time, I was able to learn about the incorporation of CAM. I thought about how to integrate this in my yoga knowledge, in my personal yoga practice, and with teaching yoga. So with pathologies and protocols, again, as a researcher, this area is very important for me. JJ had talked earlier about studies regarding yoga. So just to kind of tap into that now, currently, if you were to look at clinicaltrials.gov, there are 88 recruiting studies involving yoga, and 25 of these involving both yoga and cancer. For a nurse with a background in oncology and in oncology pharma research, to see this much research being done with yoga and cancer is very exciting. So with holistic nutrition, I do use this nutrition a lot in my classes. Um, so many cancer patients are interested in nutrition, and they're given very little advice from their oncologist. So it is a hot topic in my class. It's also a hot topic among many yoga practitioners. Have become over the years a vegan. It was a slow process. But as a vegan, I was very interested in the topics in holistic nutrition. So I have found that the holistic nutrition classes very useful. And for aromatherapy, really until I began learning about aromatherapy at ACHS, my primary exposure had only been to like lavender application during Shavasana. So my classes I now incorporate blends for varying indications and combine that with a therapeutic touch. So for incorporating my degree in CAM, my day job, and will be my day job for quite some time now, is as a clinical trial manager in oncology research. So in this position, a Master of Science degree is preferred. So it was highly encouraged, from my managers that a master's be obtained. So it is useful in my current job. I also am utilizing it to assist with protocol writing and review of protocols in regards to CAM, and teaching other team members about herb-drug interaction. So one of the things I'm seeing changing over the years as a clinical trial manager in pharmaceutical drug studies is that more protocols are now being written that address exclusionary meds that happen to be herbs due to the drug interaction. So more and more cancer patients are incorporating their own CAM modalities, many of them not exposing this to their oncologist. So within these protocols, it's written very clearly about certain herbal medications that would be excluded medications in the trials. Mainly, the one we see is we see St. John's wort. St. John's wort is known to reduce the effects of chemotherapy. So also St. John's wort is one of the most common herbs that are used among cancer patients and practicing yogis. So incorporating my degree in CAM as a yoga teacher. So I do have my 200-hour, but as was discussed earlier, it doesn't stop there. My goal is to continue in my 500-hour and go into work as a yoga therapist. So as a yoga therapist, having knowledge of all that is taught in the master's program at CAM is extremely beneficial. So as an educator, I've been asked to teach holistic health classes in our small community. So having my degree in CAM is very important there. And also through my yoga practice, my yoga class that I teach, and through my current capstone project, which is with our local oncology center, I've asked to serve as a consultant there to come in and review different CAM modalities. So in summary, through yoga and CAM, my job has taken me from there to here. So there are many great things on the horizon, I feel. There are so many different things I want to do that I feel like my journey is really, it's made a lot of progress. I have found a lot of inner peace through my yoga practice, through what I've learned from yoga teacher training. I've learned so much from the cancer patients that I teach gentle yoga to. And yet there are still so many places I want to go and so many things I want to do to be able to spread yoga therapy, and you know, my main focus will be in the oncology setting. So I talk very fast, and this has come to the conclusion of my presentation. So Renee, I want to thank you and ACHS again for inviting me to talk about yoga, and mainly to talk about yoga cam and how I incorporate it into a yoga program with oncology patients.
Yeah, that is truly incredible. And we actually do have a couple questions for you, Jeri, about your practice with cancer patients. So, what do you believe makes yoga a beneficial therapy choice for cancer patients?
Well, yoga integrates awareness of breath. It integrates relaxation, exercise, and in a class setting, social support, which in our class setting, there is a lot of social support. Um, there's a lot of talk of exercise and how beneficial it is for cancer survivors. So, you know, for some, that's what they equate yoga with. And although I don't call my program at all an exercise program, the asanas do increase strength in the participants. So also a yoga practice may assist with managing symptoms such as depression, anxiety, insomnia, pain, and possibly fatigue in cancer patients. So these are all keys to enhancing the quality of life in patients with cancer.
Right, right. It's really incredible how it can be so beneficial for them. Can you also talk a little bit more about your experience in hospitals and any other clinical settings?
Well, so I'll talk again just briefly about the program that I've developed here in our small community. Now, like I said, I am in a very small rural community.
Sure.
And
Mhm.
4 years ago, the first time, or actually it was probably about 5 years ago, the first time I brought this up to the oncologist, I made little headway. And fortunately, I came to know a psychologist that was on staff at the hospital who was a big believer in yoga and in yoga therapy. And together we were able to take the proposal, a grant proposal, to our hospital's foundation. And then in order for it to make its way through this through the process, we had to present it to the oncologist. So here we were again having to pitch this to our oncologist. But you know, fortunately, over time and through research studies, uh, oncologists are beginning to kind of change their mind on yoga. So we were able to, with their approval, get this grant and begin this program. This is done away from the hospital, and our referrals come from not only our radiation oncologist, our surgical oncologist, and medical oncologist, but from other physicians in the community. So again, for our little rural community, that's about as far as we have progressed. Now we have some exciting things on the horizon, being that our small cancer center is being um, purchased or acquired by a large comprehensive cancer center within the state, which will be bringing integrative medicine into the cancer center. So we will see more yoga therapy once this merger occurs. But what's being seen at large cancer centers like Memorial Sloan Kettering, H. Lee Moffitt, places like Duke University and Beth Israel, they are all developing inpatient yoga therapy programs, and it's to me so exciting as a nurse who did for years, you know, bedside nursing in an oncology unit, to now know that there are these cancer centers that actually have yoga therapists on their integrative teams and orders are being written by the physicians to bring in yoga therapists. And so there's yoga therapy there at the bedside. These yoga therapists need to be trained to be able to provide this type of specific yoga therapy. So there's things to consider, such as whether there are IV lines to deal with, where there are surgical wounds to deal with, especially for these cancer patients dealing with the immunocompromised patient. There's lymphedema. So all sorts of things that yoga therapists have to be trained to be able to address these cancer patients on an inpatient setting. Along with that, some of what's been found with these inpatient settings is that once patients are discharged, they want to continue their yoga practice. So there is that's kind of an area where some care needs to be taken. What some of these centers are finding is that when offering outpatient yoga programs, the patients don't want to come back if they're going to be held at the hospital. So the patients want to continue yoga, but they don't want to come back to the hospital to be able to continue yoga. At the same time, these are not, most of these anyway, are not a good candidate for going into just a standard yoga studio. They need to be handled by yoga therapists, and they need to be handled in an environment that's conducive to their healing. So as JJ had talked about earlier about the International Association of Yoga Therapists and the accreditation of yoga therapy training programs, and along with certification of yoga therapists, I think we'll see more and more yoga therapy being brought into the hospitals and into clinical settings.
Right, that's really incredible. I know also, I believe at Oregon Health and Science University, I believe they also have a gentle yoga program for cancer patients. So it really is growing, and it's really inspiring to see that, and so glad that you're involved with that as well, Jeri. So that's really, really incredible. So I'm going to go ahead and read our last question, or we probably only have time for one more question from the audience. And this comes from Margaret, and she would like to know, is it hard to find places that train you to teach yoga? So maybe, Jeri, if you want to recommend any yoga teacher training programs, you could make that recommendation, and then I can maybe open it up to JJ and Jessica as well.
So, I think that, it's a broad question as far as, I guess I could spend a lot of time talking about that. Maybe to narrow it down a little bit is there a particular type of yoga teacher training you're looking for? In other words, if you have a current yoga practice, is there a style of yoga that you are the most interested in teaching? Or what is your intent for yoga teacher training? And for me, it was really to deepen my practice. I didn't know that eventually I would become an actual teacher. But there are so many now different styles of yoga out there that, maybe kind of assessing yourself for what it is you're looking for. And, then it's according to some of it may be just what's going to be reasonable. Even a 200-hour yoga teacher training takes a bit of time out of your schedule, especially, if you have a family, if you have a job, if you're in school, do you need something that's close by? Do you need something that is, it's all at once, where some yoga teacher trainings are, a very intensive yoga teacher training and you get it all done at one time, or is it a yoga teacher training that's kind of spread out, over multiple weekends, which is what I had to look for. So yeah, I think that kind of starts answering that question. I'm sure there's a lot that could be added to it.
Definitely. So I'll go ahead and pass it to Jessica if you have any thoughts on that or any thoughts on Jerry's presentation or anything else that you'd like to share.
I know I agree with Jerry, or yeah, Jerry on the teacher training. Look local, especially if you practice at a studio. We've got a couple studios here that now offer teacher training, and you can do either an intensive or 1 weekend a month for however many months it takes. And then, if you have the time and you have the money and you want to do a particular style of yoga that's not offered in your local area, go up to New York or go out to California or even anywhere out west where they're a little more I don't want to say advanced, but they have a lot more opportunities and options out west than they do on the East Coast, unless you go to somewhere like New York City or New York. That's everywhere else. You're East Coast wise, you're a little bit more limited to your style of yoga. So yeah, I would say if you go to a normal studio and you have a particular style that you like, stick with that and look for a training. But if you're kind of open to any style and there's a couple places that are local, talk to students that have taken that training and talk to some of the teachers that are actually going to present and go with your gut on that, because you don't want to just pick a studio and spend all that time and money to get a 200-hour training and find out that you either don't really care for that style or that you didn't really get as much out of it that you thought you would. So.
Yeah, I think that's fantastic advice, really good advice. We do have I feel like on the West Coast we do have a lot of options out here for teacher training, so it's a good place to look. JJ, if you had anything to add, feel free to go ahead.
Well, I think, yeah, the West Coast certainly is hands down got a lot more going on in terms of yoga, but there is a lot going on here on the East Coast, and it's not limited to New York. So you can find, like, North Carolina, in Asheville, they say you can't spit without hitting a yoga teacher, and they've got quite a few teacher training programs there, and they are popping up more and more. So we're maybe behind the times of the West Coast, but there is a lot here, and of course I'm here running teacher training programs, so I think there's a lot going on here. So don't give up, or don't feel like you got to move to the West to get a good training program. But I totally agree with both Jeri and Jessica that, the style, you got to resonate with the style that is being taught, or you're going to, halfway through be perhaps feeling regretful or resentful, and many of those hours will not transfer to another studio's program, and you'll have to start over. So do your research up front for sure. And Jeri, I just wanted to say that was really cute slideshow you had put together there. I really enjoyed it. And Jessica, yours too. I'm feeling a little under the ball there that I didn't get one going. But I enjoyed yours, both of y'all's presentations.
Thank you.
Yeah, all of you ladies were so inspiring. So thank you so much again for joining us today. And your stories are so inspirational. And the work you're doing helping people through yoga is really quite extraordinary. So thank you for sharing your thoughts and experiences with us today. And that's about all the time we have. But if anybody out there who's listening has any follow-up questions, you can feel free to send those directly to me at reneelong@achs.edu. That is RENEELONG@achs.edu. And I'm happy to forward those questions along to our panelists. And thank you, everyone, for attending our webinar today. And keep an eye out for an email, which will go out tomorrow or Thursday with a free recording of today's webinar. And if you are interested in an education in complementary alternative medicine, like our panelists have here today, be sure to give us a call at 800-487-8839, and you can speak to an admissions advisor, or you can email admissions@admissions@achs.edu, and you can schedule a time to talk. So thank you so much, everyone, and thank you, ladies, for sharing your stories, and have a wonderful day.